In this session from the Clinical Excellence Commission, we're going to learn about histograms. My name is Wendy Jamieson and I'm the Senior Manager of the Quality Improvement Academy. Before we begin, I would like to acknowledge and pay respect to the traditional owners of the land in which I'm hosting this virtual education session, the Gadigal people of the Eora Nation. I also acknowledge the traditional custodians of the various lands on which you all work today. We pay our respects to their elders, past, present, and emerging. There will be many topics covered in this presentation, and the main learning outcomes are that we hope by the end of the session you'll be able to describe and interpret a histogram, discuss the purpose of a histogram, and also discuss when and how to use a histogram in your quality improvement project. We also hope that you'll be able to create a histogram and also identify the difference between a histogram and other charts. So what is a histogram? It's a type of bar chart used to display the variation in continuous data that is grouped into intervals or bins. A histogram is a type of frequency plot. The x-axis, or the horizontal axis, which is shown below in the red box, is continuous data that's broken down into groups or intervals of data that are set out in order along the x-axis. Typical healthcare examples include like time intervals, like minutes, hours or days, and age groups. The y-axis, or the vertical axis, as seen here in the red box, is the frequency of cases, like the number or the count of the cases. The y-axis can also be presented as a percentage, but it's usually a count or the number of cases. A histogram can play an important part in your quality improvement project. It can assist you to diagnose the causes of a problem and also demonstrate where you're doing well. It can also help you to myth bust, where you can review historic beliefs regarding, say, for example, turnaround times or the time of day particular incidents occur. It can also direct you to areas for deeper investigation. It's different to a run chart as it's not a measure over time. A histogram uses a snapshot of data from an audit or a survey. So we've said that a histogram uses continuous data. So what is continuous data? Continuous data is also known as variable data. It's obtained by recording a numerical value for each unit observed. It's depicted as either money or time, such as hours, minutes, or weeks, weight, length, temperature, or throughput, such as the number of patients seen in an outpatient clinic. It's a form of quantitative data and can be summarized by calculating the mean, median, standard deviation, etc. It can have a decimal point, in other words, a fraction, and it's used in run charts, statistical process control charts, such as the I chart and the X bar and S chart. It's also used in scatter plots and in a histogram. So some examples of continuous data in healthcare may include the wait time in minutes to be seen in a clinic or in the emergency department, the wait time in weeks for a community consultation or a clinic appointment or for elective surgery, the turnaround time of test results, such as for pathology or medical imaging, and the throughput or the number of procedures or tests performed or patients treated, say in the community or in a clinic or as inpatients, the number of surgeries performed, maybe the number of babies being born or the discharges from a ward, etc. Other examples of continuous data are like blood glucose readings or blood pressure. Some financial examples are like revenue, expenditure, or operating margins. And another example might be the duration of a consultation or a procedure, such as the length of time of a home visit or the length of time of a particular surgery. To create a chart, you'll need data. So do you already have some data that's ready to go? Or is the data elsewhere and you'll need to extract it? Or the third option might be that you'll need to collect data from scratch. So to collect data from scratch, you may need to do either a clinical audit or a survey of staff or patients or family or carers using a questionnaire. And the design of your clinical audit or your survey is absolutely critical to the robustness of your data and therefore your quality improvement project. To collect data via a clinical audit, you may do this through various different ways. First of all, might be observing a process. Another way might be reviewing medical records or the electronic medical record information. Or you might investigate incident data. Or you may also assess compliance to a policy, protocol, or a guideline. And if you do a survey of staff, patients, or family or carers using a questionnaire, you must consider getting ethics approval, particularly if you're going to be sending this out to patients or families or carers. So when you've collected your data, what we call this is raw data, and it will then need to be sorted, summarised, and interpreted. So the raw data firstly will need to be sorted from lowest to highest, and then you'll need to decide the data interval sizes, in other words, the sizes of the categories or the bins. Then you can draw up a frequency table and use that information to chart your histogram. So a histogram enables a team to recognise and analyse patterns in data that are not apparent simply by looking at a table of data or by finding the average or the median. The steps to create a histogram: firstly, collect the data. We suggest a minimum of 30 observations as your sample size, and it's even better if you can get over 50. Decide the intervals, and these must be mutually exclusive. In other words, no overlap. So the data can only fall into one interval. So we have time intervals here for pharmacy drug dispense turnaround times, and the intervals we have here from 0 to 10 minutes, 11 to 20 minutes, 31 to 40 minutes, etc. Then you need to display the data in your frequency table, and this is the number of observations per interval. For example, we had 3 observations that fell between 0 and 10 minutes. And then you need to chart the histogram from the information that's in your frequency table, such as this. When you're deciding the number of intervals or bins you're going to have within your histogram, there's actually no rule for deciding the number of intervals. However, the table below gives you a rough guide. For example, if you've got less than 50 cases or observations, then it's suggested that you have between 5 and 7 intervals in your histogram. There are 4 main steps in interpreting a histogram. The first thing to do is to look at the title of the histogram. In this instance, we're looking at pharmacy medication dispense turnaround times. And we're lucky in this example because they've actually stated the operational definition of what they were measuring, which is the time from receiving a discharge medication script in a pharmacy to the time the medication was ready for collection. This audit was done over 5 days, and the sample size is 64 observations or cases, which is great because we want over 30 observations. The next is to look at the horizontal axis or the x-axis to see how the continuous data has been grouped. In this case, it's in 10-minute time intervals. Then we look at the y-axis to see the frequency of the observations, and then look at the bars. And when you look at the bars, you determine the location, the spread, and the shape and the pattern of the data. And we can see here the most frequently occurring interval from 21 to 30 minutes where we've had 18 cases. When you're interpreting the shape of your histogram, there are particular names used to describe the pattern in the data. The example here is what's called a normal distribution or a bell curve. This example here is called positively skewed data, where it falls away to the right. And then there's negatively skewed, where the frequency is higher as we go along the x-axis. A couple of other typical shapes that you might see is like this, which is called bimodal, where we've got 2 peaks in the data. And also another type of example of a histogram is a symmetric pattern or shape. And this next histogram shape demonstrates an outlier where we have a cluster of data far away from the main data set. To really help people understand your histogram, it's a good idea to have very clear labels. So on the chart, clearly state, for example, the title, like what is the variable and what's being measured. The example here is about pharmacy medication dispensing turnaround times. Something that's optional is to state the type of chart it is. For example, here it's a histogram. Another optional thing to do is to actually state the operational definition, so a thorough description of what is being measured. So here we've got in this example the operational definition is the time from receiving discharge medication script in pharmacy to the time medication is ready for collection. This leaves no doubt in the minds of the people reading the chart as to what has been collected and the actual definition. Another optional thing to do is to state the data collection period, the start and finish times. Often one of the first things people ask is, when was the data collected and how big was your sample size? So it's not a bad idea to actually put this into the chart. And as I said before, put the sample size. It's preferable to have over 30 observations in a histogram, which is great with this one. We've got 64 cases. And always clearly label the y-axis and the x-axis so that people know what's being measured. And with the histogram, the bars must be touching. And it's best to have less white, so make sure that you alter the y-axis to finish near the maximum values. I'm now going to show you some examples of histograms that are typically used in healthcare. The example below looks at the time of day patients fell on an aged care ward. The data was collected from January to December 1 year, and the sample size is 76 patient fall incidents, which is great because we want over 30 observations for our histogram to really work. It also clearly states here what the operational definition of what a patient fall is. What's interesting when you look at this data, you can see that it's possibly what we call bimodal, where there's two peaks in the data. Here we can see that there are lots of patients falling at around 3 a.m, but also at 7 and 8 a.m, which is really interesting. But also, there's actually very few patients falling at particular times during the day. So what we want to learn from here is, why do we do well at some times of the day, and why are there so many patients falling at other times of the day? This really is a flag for further investigation to go and maybe try and look at the data to see what was happening at 3 a.m. and also what was happening at 7 and 8 a.m. You've got to be careful, though, not to make assumptions as to what was going on. You really need to try and actually get hard data to verify your thoughts. This next histogram looks at the age category of patients who fell on the aged care ward. It was data that was collected over a year, and it looks at 41 consecutive fall incidents. Flag for investigation here might be looking at why were there no patients over the age of 95 who fell. And this might be because there were actually no patients on the ward that were over 95 years old, or maybe the patients that are over 95 years old were more bedridden and not able to move and therefore at less fall risk. This example of a histogram is from mental health, and it's looking at the time of day patients were placed into seclusion. The x-axis is the 24-hour clock, and the data set is quite big because it's 316 cases. This data set appears to have kind of two interesting peaks around 2 o'clock in the afternoon, but also at 11 o'clock at night. So a flag for further investigation here might be to think about, why are there those two peaks at 2 o'clock in the afternoon and 11 o'clock at night? You might want to pause this slide and have a look at the data and think about, what else do you find interesting in this shape of this data? This next histogram is looking at unplanned readmission to hospital. The y-axis in this case is percentage, and the x-axis is looking at post-discharge readmission day interval, and they're 5-day intervals. It's a large data set that they've pulled this information from, which is 108 patient readmissions from a year's worth of data. And they've spelled out the definition of what an unplanned readmission is, which is the days from the patient being discharged to the days the patient represented back to hospital. It's interesting data because what we find is between 11 and 15 days, we've got just under 52% of patients bouncing back to hospital during that time frame. So a flag for further investigation is to try and dig down and work out why so many patients bounce back between that time. With histograms, you can also stratify the data, and that is where you compare different categories. Say, for example, male versus female, or weekday versus weekend, or first year versus second year. With stratified histograms, generally the y-axis will be expressed as a percentage because of the different sample sizes. So with the example below, we're looking at the wait time for pediatric patients to be seen by the doctor. And what we're doing is comparing the weekday versus weekend data. You can see here there's quite a big difference between the sample sizes. So the weekday there's 283 cases, and on the weekend there's only 38 cases. That is why the y-axis is best expressed as a percentage. So with the Example below, looking at paediatric patients waiting to be seen by the doctor in the emergency. The blue bars demonstrate the weekday wait time and the red bars are the cases from the weekend. The weekday data, it's really showing a weak positively skewed data where 93% of the patients are seen under 60 minutes. Whereas on the weekend, the data shows there's lots of variation and also that 47% are seen under 60 minutes and just around 29% wait between 61 and 70 minutes. So on the weekends, there's room for improvement regarding waiting times. This stratified histogram is looking at COVID-19 cases from New South Wales. The data is broken down by age group and gender, and it's from the 22nd of January to the 2nd of July 2020. A flag for further investigation is when you're comparing males to the females. You can see that there are more females infected with COVID-19 who are between the age of 20 and 29. Also, there's less females compared to the males in the age group of 40 to 49. So it's interesting data and that's something to be investigated. But also it's interesting to note that there's few cases, very few cases of COVID-19 from 0 to 19 years. And there's also an area for further investigation as to why. In this next stratified histogram, we're again looking at data from New South Wales Health on their COVID-19 cases. This graph we look at lives lost by age group and gender. A flag for further investigation is when comparing to males, why are there more females' lives lost in the 90 and above age group? Also, it's interesting to note as this is a negatively skewed histogram and there are very few deaths from the ages of 0 to 60 years, which is interesting and something we need to further investigate as to why. I'll now show you how you can create your own chart using the ready-made templates on the CEC website. You can easily create your own chart using the user-friendly ready-made templates on the CEC website. And we have two different systems where you could do this. Either on the Quality Tool web pages and you click on the chart that you want and then there will be an Excel template for you. Or you can use the Quality Improvement Data System or the QIDS system. You'll need to be registered to access the QIDS system by your local QIDS coordinator in your LHD or your network, and this is for New South Wales Health staff only. To get to the CEC Quality Improvement Tool webpage, you could use this URL or go to the website and the menu Quality Improvement Academy and Quality Improvement Tools. So this is an image of the Quality Improvement Tools webpage on the CEC website. And here are the different quality tools. And you click on the tool that you want and there'll be information about that particular tool and the Excel templates. We have Excel templates for run charts, Pareto charts, histograms and scatter plots. For New South Wales Health staff, there's a system that you could use to create charts. This is called the QIDS system or the Quality Improvement Data System, and you'll need to be registered to use this system via your LHD or network. Or you can find the login through Quality Improvement and then go to the QIDS and QAS section on the CEC website. When you're into the QIDS system, you need to click on Improvement Projects and that will take you through to the chart templates. When you're in the Quality Improvement section in QIDS, you click on Charts and New Chart and up will come a range of charts that you can choose from, such as a run chart, control chart, Pareto chart, histogram or a customized chart. So using the Quality Improvement Tools webpage, we're now going to demonstrate how easy it is to create a chart using Excel from one of the templates that have been set up for you. I'll now do a demonstration on constructing a simple histogram in Excel using the template from the CEC website. The Excel template sheet tabs include firstly instructions on how to and when to use a histogram and a simple template to create a very simple histogram. The next sheet has examples of various histograms. The third sheet looks at interpreting the histogram shape. The fourth tab has a template for a stratified histogram, and the last tab has instructions for how to construct a histogram using a very large data set. So if you have a very small data set and you've already decided firstly on the category or the bin intervals, and you've also manually tallied up the number of observations per category or bin, the next step is to create the histogram in Excel using the template on the CC webpage, or you can actually do this in the quiz system as well. So when you open up the Excel histogram template, scroll down past the definition and the instructions, and what you'll find is the frequency table and the chart template. All you do is simply key your data into the frequency table and the chart will automatically grow. Then you need to follow the instructions to tidy up the chart, like for example to give it a title, name, and maybe state the data collection days and also the sample size. I'm now going to demonstrate in Excel how easy it is to do a histogram with this template. So this is the information about what a histogram is and how to build a histogram and steps to follow. So basically you follow those steps, which are to put in the different categories for your x-axis. I'll just finish that off. I've got here from 91 minutes. And then you put in your data. So I've collected some data on, say, medication dispensing turnaround times. And I'll just put in my data that I found and that I categorized. And you can see that the graph is automatically growing. Then you follow the instructions. It will tell you to delete the rows that you've not used. And there is the chart that's grown automatically. What you need to do now is some chart hygiene, where you put in the title of the chart and the operational definition of what you're talking about and the sample size and the data collection dates. They're all optional, but it is good to actually put that information in. And you can also label the x-axis to say that it's categories of time, turnaround times for medication dispensing. That's just a simple way of doing a histogram in Excel using this template. Now it's over to you. In this exercise, what we'd like you to do is pause the video, and we'd like you to look at this data and we'd like you to create a histogram using the frequency table below. Either create your histogram by hand, by drawing it by hand, or use Excel, or use the quiz platform, but that's only for New South Wales health staff. So here we have a frequency table looking at pharmacy drug dispensing turnaround times. We have the time intervals there in 10 minutes, and then we have the frequency in the next column, which is the number of cases that fell within those time intervals. And the answer to this will be revealed on the next slide. So go ahead now and draw a histogram from this data. So how did you go creating a histogram? Did you draw it freehand, or did you use Excel, or did you use Quiz? And did what you produce look something like this? So this is the histogram which resembles the data in that frequency table. So what we want to see in your histogram is that it's bell curved or a normal distribution from this data. The x-axis, we want to see that they're clearly labelled, those time intervals, and that it's quite apparent what they are. These are 10-minute time intervals. On the y-axis, we want to see that it's been clearly labelled. We're looking here at frequency. We're not looking at percent. It's either frequency, number, or count. We also want to see that you've given your graph a very clear title. Here it says it's pharmacy drug dispense turnaround times. I've also stated what type of chart it is, which is a histogram. So this is a clearly well laid out graph. There is also an automated way of creating a histogram. This is particularly good if you've got a large amount of data. So if you've got a very large data set, it may not be convenient to try and summarize your data manually to create your histogram. So in this case, follow the steps in the histogram template in Excel by going to the sheet or tab labeled Large Datasets - Steps. And these steps are outlined below as well. So in summary, the features of a histogram is that it's a bar chart used to display the variation in continuous data that's grouped into intervals, which are also commonly called bins, particularly in Excel. It's a type of frequency plot, and the x-axis plots continuous data that's grouped into intervals or bins, and the y-axis, the vertical axis, is either frequency or percent. And what we mean by frequency is either the number or the count of cases. The data can be collected initially via an audit or a survey, and it's best to have a sample size of at least 30 observations or at least 30 cases. And traditionally in a histogram, the bars actually touch. So that's a summary about histograms. Okay, we're now going to do some quizzes. And this first quiz, what I want you to do is look at the chart below. And the question is this a histogram, true or false? So take your time or even maybe pause the video and I'll reveal the answer in a moment. Okay, the answer is true. This is a histogram. And the reason why is when you look at the x-axis, it's using continuous or variable data. The y-axis is a frequency. They're using bars to plot the data and the bars are touching. So this is a histogram. Okay, quiz number 2. Is this graph below a histogram? Again, take your time, study this and pause the video if you'd like. And I'll reveal the answer in a moment. So true or false, is this a histogram? And this is false. This chart is actually a run chart. And a run chart or a line graph or a time series graph demonstrates data over time. The x-axis on a run chart is, in this example, patients that are seen in chronological order. And the y-axis is minutes, whereas in a histogram we'd want to see the y-axis looking either percentage or the number or count. Okay, quiz number 3. Is this chart below a histogram, true or false? Again, pause the video to study the chart below. And the answer is true. This is a histogram. The x-axis is a continuous variable. The y-axis is a frequency or number. We were counting the number of falls. This chart is about the time of day patients fell above and below 50 years of age. So this is a stratified histogram. And the bars are used to plot the data. Quiz number 4. Is this a histogram? So look at the chart. What do you think? Is this a histogram, true or false? Again, pause the video to give yourself some time to digest this chart. The answer is false. This is actually not a histogram, it's a Pareto chart. Histograms and Pareto charts can be quite easily mixed up. In a Pareto chart, the x-axis is what we call categorical data. It's not continuous data we're looking at here, it's categorical data where data forms into distinct categories. In a Pareto chart, the bars do not touch, whereas a histogram they do. And a histogram, we don't have things like a cumulative percent or an 80% cutoff as well. So be very careful that you don't get mixed up between Pareto charts and histograms. Quiz number 5. Is the graph below a histogram, true or false? Again, pause the video to give yourself some time to answer this question. True or false, is it a histogram? And the answer is false. It's actually a scatter plot. So the y-axis is not count or frequency, it's another continuous variable. So a scatter plot uses continuous data on both the y and the x-axis. And a scatter plot uses dots to display the data rather than bars. Okay, quiz number 6. Is 30 the minimum number of observations or cases or data points that is recommended for a histogram, true or false? Pause the video if you'd like. And the answer is true. The minimum number of cases that we prefer to see in a histogram is 30 to give that degree of belief. Quiz number 7. What is the shape of this histogram? Is it a normal distribution, a positively skewed distribution, negatively skewed, or is it bimodal? Pause the video if you'd like. The answer is that it's positively skewed. Quiz number 8. What is the shape of this histogram? Is it a normal distribution, positive skew, negative skew, or bimodal? The answer is this is a normal distribution or a bell curve. And what is the shape of the data in this histogram? Is it normal distribution, positive skew, negative skew, or bimodal? The answer is it's bimodal because you can see those two peaks. Quiz number 10. The question is, Mutually exclusive observations in histogram means that a case can only be allocated into one interval or bin. Is this true or false? Pause the video if you'd like to then study this question again. And the answer is true. For your information, the references used to inform this presentation are listed below, and you may want to either consider purchasing or borrowing some of these books if you'd like to learn more, particularly the three that I've highlighted in these images. Please consider following the CEC on any of our social media, such as Twitter, YouTube, or LinkedIn. This is the end of the session, so please let us know what you thought of this virtual education offering by completing the electronic evaluation survey or by sending us an email. Thank you very much and all the best.